Welcome to Muslims and Mental Health with Sister Heather, a groundbreaking program looking at mental health issues through the biopsychosocial spiritual paradigm.
Welcome to another episode of Muslims and Mental Health. Today we are going to be discussing mental illness awareness. October 4th is the beginning of Mental Illness Awareness Week. And we're going to be looking specifically at just some raw numbers and how mental illness both affects our society and how we can help and what we need to be looking for. So I want to start by mentioning also that if you go to the National Alliance of Mental Illness at NAMI.org, NAMI.org, you can find lots of opportunities and ways in which you can participate and learn about mental illness and get active and be involved and even donate if you are so inclined. So let's start by talking about the prevalence of mental illness, because a lot of people are unsure about how frequent we're seeing actually mental illness in the United States and around the globe. And if you look in the United States, approximately 1 in 5 people, in other words, 43.7 million, or roughly close to 20% of our population experiences mental illness in a given year. 13.6 million, or 4.1%, experience a serious mental illness in a year that substantially interferes or limits their major life activities. So it makes it difficult to, go to work or have relationships with people. Approximately 1 in 5 youth aged 13 to 18, that's 21.4% of our youth, experiences a severe mental disorder at some point during their life. For children aged 8 to 15, the estimation is 13.3%. 1.1% of adults living in the United States live with schizophrenia. Now, you may hear the percentage of 1.1% and think, well, 1% is not that much. But when you consider the total population, we're talking about 1 million or more people in the United States living every day with schizophrenia. 2.6%, which is a little bit more, of adults in the U.S. live with bipolar disorder. And 6.9% of adults in the U.S., which is 16 million people, had at least one major depressive episode during the past year. 18.1% of adults in the United States experienced anxiety disorders such as post-traumatic stress disorder, or PTSD, obsessive-compulsive disorder, or otherwise referred to as OCD, and specific phobias. Among the 20.7 million adults in the United States who experience substance use disorder, 40.7% of them, or otherwise 8.4 million adults, had a co-occurring mental illness. You can see more about these numbers at NAMI.org, and I want to now shift into, what does this mean? What are the social implications of these various types of mental illness in our society at large? Well, they're quite significant, and you might be surprised to hear some of these statistics. An estimated 26% of our homeless adults staying in shelters live with serious mental illness, and it's estimated that 46% of them live with severe mental illness or substance use disorders or co-occurring disorders. And this is really serious. As we know, in Los Angeles, there has been a state of emergency called on the homeless. And so if you can imagine, we have a state of emergency about homeless people living on the streets to begin with. And then on top of that, a lot of them have mental illness or some kind of mental distress. And so this is a very serious issue. And then when we switch and we look at what have been referred to as the 2 largest mental institutions in the country, which is LA County Jail or Cook County Jail in Chicago, we can see that approximately 20% of state prisoners and 21% of local jail prisoners have a recent history of a mental health condition. There are many people in prison who are unidentified with mental illness, but who have severe or mild to severe mental disorders. 70% of the youth in the juvenile justice system have at least one mental health condition, and at least 20% of them live with a serious mental health illness. Only 41% of adults in the United States with a mental health condition receive mental health services in this past year. And among adults with serious mental illness, 62.9% of them received mental health services in the past year. So if we kind of look at roughly, 40% are not getting the help they need. And with just generally people suffering with a mental health condition, approximately 60% of them are not getting the help that they need. Just over half of the children, 50.6% of them, aged 8 to 15, received mental health services in the previous year. And we see a great disparity among this when we look at multicultural issues. So, for example, African Americans and Hispanic Americans are using the mental health services at about half the rate of Caucasian Americans. So what does this mean? Well, part of it means, there is stigma attached to mental health in a lot of the minority cultures, but there also exists a lack of cultural sensitivity and understanding to treat people from minority cultures. So there is a lot of work that needs to be done in both directions, both clinicians getting more culturally sensitive and understanding what the particular needs are of, for example, African Americans or Hispanic Americans, and then on the other end, those particular communities seeing the need and the importance of getting mental health services. So work needs to be done in both directions in that regard. Half of all chronic mental illness begins by age 14, and 3/4 by age 24. So it's typically believed that by the age of 24, the brain is fully developed, and that's why we see some people getting diagnosed at 24, but starting to be diagnosed by the age of 14. And despite the effective treatments that we have, there are long delays, sometimes decades, between the first appearance of symptoms and then when people actually get help. So they might have symptoms earlier on, but are not getting help till much later because of several reasons, right? Either lack of access to care, because we find also sometimes if people don't have insurance that covers their health care or mental health care, they may avoid getting it because of the expense. Although we do have many clinics now that are based on a sliding scale fee, meaning that they look at your income and they base your fee on the income. People are still not getting help, or they're not having access to them, or they're not even aware that they exist. And so there's a barrier there for people getting access, but it's also because, believe it or not, we don't have enough therapists who are licensed and trained in our society to handle all of the mental health care needs that we have. And so, and then there are also some other reasons. For example, if somebody has trauma, like a sexual trauma, it may be repressed and they don't get help until later on in their life. So there are many reasons why it might be delayed, but some of it is around social stigma, access, barriers to healthcare, and financial barriers as well. Another consequence for the lack of communal action is that serious mental illness cost Americans about $193.2 billion. Let me say that again, $193.2 billion in lost earnings per year. Now, what are we talking about when we say lost earnings per year? Well, obviously, we know the productivity that people, if they're ill, they're going to be taking sick days. They're not going to be able to focus as well. There are many reasons that go into this lost earnings per year, but $193.2 billion is quite significant. Mood disorders, including major depression and dysthymic disorder, which we now call persistent depressive disorder, and bipolar disorder, are the third most common cause of hospitalization in the United States, for both youth and adults age 18 to 44. Again, let me repeat that because I'm not sure that people really realize the significance of this. Mood disorders, major depression, and persistent depressive disorder, bipolar disorder, they're the third most common cause of hospitalization in the United States for both youth and adults age 18 to 44. Individuals living with serious mental illness face the increased risk of having chronic medical conditions. Adults in the U.S. living with serious mental illness die on an average of 25 years earlier than people who do not, and it's largely due to treatable medical conditions. So if they were actually getting the help that they needed, their life could perhaps be extended by a number of years. Looking at some of the other consequences for the lack of communal action, over 1/3 of students with a mental health condition aged 14 to 21 and older are served by special education and are dropouts, the highest dropout rate of any disability group. Suicide is the 10th leading cause of death in the United States, the third leading cause of death for people aged 10 to 24, and the second leading cause of death for ages 15 to 24. If we think about that, that's pretty significant, and it's very serious. More than 90% of children who die by suicide have a mental health condition. Each day, an estimated 18 to 22 veterans also die by suicide. And when we look at the numbers of veterans who have died, we notice that more veterans have died by suicide than were killed in the Middle Eastern conflicts. So it's very prevalent, it's very serious. Our community needs to take action. We need to raise our awareness around this issue. And one of the things that we can do to help is to be aware of the warning signs to look for if somebody that you know or someone in your family may be suffering from a mental illness, or yourself if you also may be suffering from something and are unsure. So let's look at some of these warning signs. Some of the warning signs are excessive worrying or fear, feeling excessively sad or low, confused thinking or problems concentrating and learning, extreme mood changes, extreme weight changes, uncontrollable highs or feeling euphoria, like sort of mania, prolonged or strong feelings of irritability or anger, avoiding friends and social activities, difficulties understanding and relating to people, changes in sleeping habits, or feeling tired or low energy. Of course, I caution you if you're a person who's not getting regular sleep. We know that after 3 days of not getting good sleep or being having insomnia, you actually can present psychotic features. So it's really important to get your sleep. But also changes in eating habits, such as increased hunger or lack of appetite, changes in your sex drive, difficulty perceiving reality, like having delusions or hallucinations that are not substance-induced, an inability to perceive changes in one's feelings, or your lack of insight, like you're not able to have insight into your own actions anymore, abuse of substances like alcohol or drugs, multiple physical ailments without obvious causes, like somebody says, my stomach aches, but they can't figure out why, or they have like sort of vague aches and pains all over their body. Thoughts about suicide. If someone expresses to you that they are suicidal or having suicidal thoughts, it's important to get them help right away. And we have, fortunately, several suicide hotlines. There's a suicide prevention hotline. There's the D.D. Hirsch suicide hotline. There are many hotlines to refer to if you know somebody who's suicidal. Also, an inability to carry out daily activities or handle their daily problems or stress. They feel overwhelmed a lot. In children, there are some more specific ones I want to alert you to just to be aware of because they can be slightly different and more obvious in some ways. So if we look at changes in school performance, excessive worry, like they don't want to go to school, they're afraid to go to school, hyperactive behavior on the other end, frequent nightmares, frequent disobedience or aggression toward others, and frequent temper tantrums. These are warning signs to alert you that there might be something else going on and worthy of being checked out. So this week, I hope you take part in and learn more about mental illness and become more aware of it. Again, you can look at the activities that are going on this week at NAMI.org. It's NAMI.org. NAMI is also having, during this month, different dates in different counties, the NAMI Walk, which is to both raise awareness and money for the organization. And if you look at NAMI.org, you can find out where your local community is having those events. Again, please take time to learn about mental illness and raise your awareness around this very crucial issue that is affecting our society and the global society as well. Thank you, and this concludes another episode of Muslims and Mental Health. You can give us your feedback, your comments, and your concerns at nafshealertherapy@gmail.com. That's NAFSHEALER therapy@gmail.com. You can also see a list of important resources at nafshealertherapy.wordpress.com. So we look forward to seeing you again. Thank you.
Hi, welcome to Adelante. This is Adelante Recovery, and my name is Yvette Kuglin, and I'm part of the staff.
Adelante Recovery Center has helped people in dual diagnosis for 5 years. We accept most PPO insurances and provide luxury accommodations and 24-hour support. To speak with an admissions counselor, call 1-888-242-4450.
A lot of time we don't even know what's wrong with us, and sometimes we need to get away to figure that out. So if you want to go for a little retreat out in Corona Del Mar, which is a confidential location, we're here to help. So we're only a phone call away. Thank you.